I was lucky to present the results of this phase 3 randomized study at EHA. This study focused on patients with relapsed myeloma, and it is a prospective comparison of Carfilzomib and Dexamethasone, that is one of the standard of care in the relapse setting, versus Carfilzomib, Dexamethasone plus Isatuximab. Isatuximab is a CD38 antibody, and patients were randomized 3-2 to receive either KD at the usual dose of Carfilzomib, 56 milligrams, versus the same combination plus Isatuximab, Isatuximab IV at the dose of 10 milligrams per kg on day 1, 8, 15, 22 for cycle 1, and subsequently every 2 weeks until progression. The primary endpoint was progression-free survival, and the study focused on patients with 1 to 3 prior lines of treatment. 302 patients were enrolled. The patient characteristics were well balanced in both arms, in fact. And when looking at the PFS, the primary endpoint, there is a huge benefit of the addition of Isatuximab. The KD arm is associated with a median PFS of 19.1 months, and it is a good control arm. Definitely, when we are looking at Endeavor, the pivotal study for the approval of KD, the median PFS was 18.7 months. And if you are adding Isatuximab on top of KD, the median PFS is not reached, and the hazard ratio is 0.53. So this represents a 47% reduction in the risk of progression or death with the triplet combination. All subgroups of patients are benefiting from the triplet, and interestingly as well, we looked at MRD negativity at 10 to the minus 5 by NGS, and on an intent to treat basis, the MRD negativity rate is much higher with Isatuximab versus KD alone. Almost 30% of the patients did reached MRD negativity versus 13% only. Time to next treatment was also improved and delayed, in fact, with Isatuximab with a hazard ratio of 0.56. So this is a notable delay in the time to next treatment. And well, currently with a median follow-up of 20 months, we don't have any overall survival difference, but the OS data are not mature at the time of the analysis, and the study obviously is ongoing. When discussing about the toxicity, the number of fatal events was identical in both arms, and also the adverse event leading to definitive discontinuation of therapy were identical in the two arms of the study. And when looking at all adverse events, there is no new safety signal, and definitely the triplet combination has a manageable safety profile. With the addition of Isatuximab, you are not adding any significant toxicity. And the infusion-related reactions that mainly occurred during the first infusion of the drug were mostly grade 1 or 2 and did not lead to any Isatuximab discontinuation. So definitely new triplet combination, Isatuximab KD, that is very interesting in the relapse setting with a very good activity. The study met its primary endpoint, and I think that the study will introduce this triplet combination into the strategies in the future. Potentially, this is the pivotal study for the approval of this new triplet combo.